When we sit down, it's time for the conversation. This time, virtual conversation in the times of coronavirus. I'm joined by Dr. Alfred Mutua, who is the governor of Machakos County. Governor, thank you for making time.
Asante sana, I'm very glad to be here.
Into our conversation, let's just go through our guest profile today. Now, our guest, like I said, is Dr. Alfred Mutua. He's the governor of Machakos County from 2013 to date. He is the former government of Kenya spokesperson from the year 2004, resigning in 2012. He is also the party leader of Maendeleo Chap Party. He holds a master's in communication from Eastern Washington University and a PhD in communication and media from University of Western Sydney. That is the profile of our guest today. Governor, I would like us to begin our conversation from a very basic point of view. The very first case of coronavirus was reported in Nairobi early March. Now about 16 counties have reported cases of coronavirus. What do you think has led to the spread of coronavirus across the country, so to say?
I think it was expected, and the reality is that Kenya has done well. We've done better than many countries like Iran, Italy, South Korea, and other countries that really faced a big problem. The challenge has been that I think it took us some time to understand the veracity, the dangers of this disease. So we didn't do the lockdown, we didn't do the curfews early enough, we didn't do the restriction of movement early enough, and 190 were not taking it very seriously. But I think we have to give credit to Uhuru Kenyatta's government. They have moved with speed, they have contained. Yes, more could have been done, but now it is in the hands of 190. I think the governments have done enough. It's in the hands of 190.
Speaking of the government doing enough, what do you make of the measures that we are now beginning to take? We saw Eastleigh is in lockdown, Mombasa Old Town is in lockdown, Nairobi County also is in lockdown, there's no movement in and out. What do you make of these measures that we are taking now?
I think they're okay, but they may not be enough. You know, it may get to a point when we may have to just stay at home. In some of these places that have the major cases, we may have to ask people just to stay at home for about 14 days or 21 days so that we can stop the disease from spreading. The problem with this disease is that it spreads very quickly. So if we contain people for 21 days in their homes, that means that within 14 days, anybody who is sick is either healed or has been identified and is taken to hospital. So there is the catch. The problem is that we don't have enough testing kits to test everybody. Now the advantage of this is that we are not seeing people going to hospitals across the country who are unable to breathe. We're not seeing people falling down dead. So we've not reached that stage, and I hope that we'll not reach that stage. So when you look at Italy, for example, and you look at the containment that is being done in Italy, you find that a lot of people have been infected in Italy because of poor habits. You know, people are not taking it seriously. And so we have to come and say, these goods are in Italy, these things in Italy can actually trickle to the rest of the country. So we have to do those lockdowns.
I want us to come to your county and talk matters preparedness. What are some of the steps that you've taken, Machakos County, for example, to ensure that you're prepared for any eventuality with relation to coronavirus?
I think the advantage that we have in Machakos is that we started being prepared for any eventuality since 2013. When I was given 140 million to buy luxury cars, I instead used that money to buy ambulances. Machakos has 40 wards. We have 75 locations. There's an ambulance in every location. We have better distribution of ambulances than any other county and even the region. We are equal to South Africa. We are equal to Cairo. We are equal to the UK. We are like Australia in terms of that. I invested heavily in healthcare. I employed an extra 800 nurses and assorted healthcare workers of another 300. We've built the Machakos Cancer Center. We have where we are treating people for free of charge. We have universal healthcare. We have revamped our health facilities. We've opened more. I just opened another 10 community hospitals across the country. Our hospitals are clean. They have equipment. They have all these things. We can now do brain surgery. We've gotten more ambulances. We had bought 8, now we've got another 10. So when Corona came as a public health issue, it found a county that is already grounded in terms of public health issues. And so it was very easy for us to put together a surveillance team, to put together a program to do fumigation in all our markets, which we've done, to do testing. We had already bought a bag or a basket called that Sanduku la Daktari with all these thermometers, the thermoguns, the triage facilities that we had already bought a year ago and distributed to basically every health facility in Machakos County. So when the disease came, when other people are looking for guns, thermometer guns, we already had them. We already had all those equipment. We already had a lab because of our pathology in Machakos Cancer Center. That is why we are testing COVID-19, which shows now we are reaping the fruits of our hard labor. Utavuna ulichopanda.
And I saw that you turned Machakos Stadium into an isolation center. Talk to us about that.
Yes, what we realized when we looked at it, we realized that whenever somebody is sick, when you're not feeling well, when there's a pregnant woman, whenever you have malaria or typhoid or whatever, your immune system is weak at that time because your white blood cells are busy fighting that injury that you've got. Now, when immunity is weak, it is very easy to get infected by other diseases like COVID-19. Therefore, the mistake that was done in Italy was to take these COVID-19 people to hospitals where other people with other diseases were already admitted. So everybody in those hospitals basically got COVID-19 and they died because they were already sick from other diseases. The same thing happened in New York. So even to make work easier for health workers, we decided that we are going to have a field hospital because this is a disease that will pass. And so we created Machakos Stadium to be a field hospital, whereby we can also do mass testing and we can isolate anybody who is sick.
I want us to talk about some of the challenges that you have experienced and even counties in general, because you sit together with the fellow governors in the Council of Governors. What are some of the challenges that counties are encountering during this coronavirus pandemic in terms of just being prepared and keeping their people safe?
I think the main issue is issue of money and finances, because we're being told to buy ventilators. A ventilator is about 3 million shillings. Now we've got the issue of vulnerable people who we need to feed. And then now we've got the floods. So we've got a cash flow. And the problem is not just about cash, it's not about not having money. It's also because the cash flow, that we are getting. In Machakos, for example, the last allocation by the national government was in February. We haven't received March, we have not received April, now we're in May. So we don't even have money that is actually due to us. So those are the challenges. In terms of bureaucracy in the national government, it takes forever by the controller of government to approve payments. So that is the main challenge that we are facing as governors. We've been promised money. We hope the money will come from international partners so that we can be able to help our people.
And some time back, I attended a presser by the COG where Governor Paranya said many governors were using their emergency kitty and they have exhausted. So currently, in terms of survival, what kind of resources are counties using? And maybe before the national government comes through with the finances, how will counties survive?
We have to divert funds. We have to say non-essential things. We have to stop construction of roads. We have to stop buying things that are not health related to put the money in health. That means that all counties will need a supplementary budget. I'm preparing one myself, and we are preparing some so that we can be able now to reallocate money, because this is a difficult time. This was not foreseen. So extraordinary times call for extraordinary measures and extraordinary leadership.
Must rethink its revenue allocation to counties, because now we are beginning to understand the importance of devolution and devolving these services back to the people. During one of the plenary hearings, I think with the Senate, you raised a point with health and said devolving health was a good thing for the people, and taking back some of these functions back to the national government beats the whole logic. So in terms of revenue allocation, how should the national government rethink the portions it allocates to counties, bearing in mind that grassroots feels the burden the most?
I mean, there's a lot of money that is stuck in the national government. I mean, they keep 85% of the money. 15% of our internal budget is the one that only comes to county. 15% is shared among 47 counties. We get a drop in the ocean, yet counties are where the people live. The rural areas, they're in counties. So we have to, that's why we've been pushing for 45% allocation to come to counties so that we can be able to do the work. The national government is trying to do a lot of the work that is already devolved. So they need to follow the constitution. And then there's this clamor to take back, to take back the health functions to the national government. It's a big joke. When I go to Machakos, they had 6 ambulances, 4 were broken down, 2 did not have fuel. Our mothers were dying on the road being carried by wheelbarrows. I mean, it's pathetic. Machakos is the face of what is across the country. Kakamega, Kisii, you go Wajir, Mandera, health facilities have improved. We've employed better doctors. We are able to be able to administrate them properly because we are here. Decisions are not being made by somebody in Afia House, who does not even know what is going on the ground. And so, that is what is happening. And the reason they want to take it back has nothing to do with healthcare. It's because they want to control the money. Afia House, that's why I'm calling it Mafia House, has been a den. People have been murdered. It's a cartel den. It's a den of corruption. It's big money. So they want to control this big money. And now they are feeling that this money is actually going to help Mwananchi. Nowadays, all counties, there's medicine, people are not sharing beds, things are going well. But a few greedy people want to make all the money because we've become a country of a few corrupt, rich people and majority of us who are poor. But we will not agree to that. Any attempt to take back healthcare to the national government will cause a revolution in this country. Wananchi are getting tired. We are tired of these games. We are tired of these machinations. The rights of the people need to be there. Tumechoka kuenjoyiwa, as we say.
And speaking of just the people, because there are other counties, speaking to your fellow governors, what are some of the things that different counties have done that stand out in the fight against COVID-19?
I think other counties have done well. I've seen what has been done by all counties. We've seen fumigation happening everywhere. We've seen distance spacing. We've seen governments giving masks to people. We've been working closely with national government. And I want to thank all the governors in this country. Each governor has done his job according to his own capacity and ability. And that is why we are saying that we are defeating coronavirus because of this combined effort being led by our president and the governors, the executive leaders of this country.
Talk a little bit about the economic effect that coronavirus is having. We've seen world over, it's really shaking economies. GDPs are being slashed by half, if not just a quarter of their projected growth. At counties level, what kind of impact is coronavirus likely to have if it has not had on the economies of those counties?
I mean, our economies are in shambles. You find that people have been told, go home, don't come to work tomorrow. There's a slowdown. For example, I'm collecting 600 million less than what I should have been collecting in terms of my revenue because nothing's happening. Construction has stalled. Basically, it's not happening. And so the country is losing a lot of money as a result of corona. We are diverting money for development, for roads that are supposed to spur the economy so that now we can pay for medicines. So we've been badly affected. But we've also been badly affected because we are a poor country. We are a poor economy. Because our leadership, the way we vote, we do not vote for leaders, we vote for politicians. And so it is embarrassing that when Mzee Jomo Kenyatta died 22nd of August 1978, Kenya was richer than Singapore, Thailand, Malaysia, South Korea. And it is embarrassing that South Korea are making phones called Samsung, are making TVs called LG, have cars called Hyundai. It is embarrassing that Singapore wants to give us aid. They are poorer than us. Now they want to give us aid so we can combat coronavirus. Yet they were poorer than us a few years ago. So we have to rethink about leadership in this country. We need to choose leaders not based on tribe. We need to choose leaders based on ability to transform our lives and have more money in our pockets, not based on chieftains, not based on huyu ni mtu wetu, huyu amekaa hapa, and then all of us tunahangaika na umaskini. We must wake up, and I challenge the media to tell our people, to educate our people that you want a leader who understands economics. You want a leader who understands how to turn around a country. You want a leader who is selfless, not a corrupt person. That is the only way of changing our country. But if we continue electing politicians, mtu wetu, then we are finished. We are finished. We'll always be poor. The Chinese will always throw us out. We'll always be racially, subjugated. We'll always be scorned. And people will laugh at us because we are told we have the richest continent in the world, but we are the poorest. I mean, it just blows my mind.
Let's talk about revival, because we saw the president give a directive that said he was going to allow restaurants to reopen if they adhered to particular hygiene standard. It means we can't be held ransom by coronavirus for the rest of the year. A time has to come when we have to go back to business. What kind of economic revival stimulus package are you considering at county level?
I think we're not in a position to do any stimulus package. What we have done is, for example, we've stopped charging duty for border drivers. We've stopped for tuk-tuks. Matatus, we are charging only 50%. Mamambogas, people in market, we're not charging any duty. We're trying to give them a comfort level. But we're not in a position to give any economic stimulus to our people, because the same point I was saying, we are a poor economy. We don't have enough money. So we need people to get to work. The issue of restaurants, it's a catch-22. Either they go back to work and we spur the economy, or they stay home and we continue starving. So it's a catch-22, but I think it should be experimental. We should start with counties that have no records of coronavirus, see how it goes, and then we open slowly by slowly. Here in Nairobi, people are going to bars. Now, if you go, I was in Nairobi the other day, and you look in Nairobi, some restaurants are open. Watu wamejazana kabisa. People are drinking themselves silly, and we are going back to the old habits, which may make life difficult for us.
Almost come to a close. Some governors like you, some governors like Kivutha Kibwana, some governors like Ali Hassan Joho 001 have done really well. However, kuna wengine katikati yenyu ambao hawajafanya vizuri in terms of preparing their counties na wanawaacha some of their residents very vulnerable. We've seen very disheartening photos of some counties that do not even have quarantine facilities. We've seen some governors use public money to print their faces on sanitizers. We've seen some even engaging themselves in corruption scandals at this very time. I'm sure you've heard on the media of the county that procured jerrycans at 10,000. So what does this say, particularly at this time of a pandemic? Why aren't we seeing your fellow governors pulling up their socks and serving people?
I think they're doing it their way, and I don't talk about my fellow governors. Even in a classroom, not every person comes number one. In a classroom. So people do things differently, and I think they're all trying differently. What is important is that we have to focus on fighting corona, but more important, we have to focus on fixing our country. I mean, in Australia, where I did my PhD, as you read, every household is getting about 100,000 shillings. Every household inatoka kwa serikali per month kwa hii miezi ya corona. So uende kazini, usiende kazini, unapata 100,000. In New York, in the US, anybody who has been unemployed is getting money. Unaenda unajiandikisha unemployment, social welfare, you're getting a check every month so that you do not starve. Hapa kwetu unaambiwa omba Mwenyezi Mungu, kaa nyumbani. We have to change these things.
As we wind up, there was a time you a very valid point, and you said corona inatufunza adabu. Manake kitambo wanaojiweza walipokuwa wagonjwa, you fly to New York, you fly to Germany, you get treatment. But now borders are closed and all we have is Kenyatta and Biography. I want us to talk about the lessons that we can draw from coronavirus on how to improve our systems and make them work for us. Governor.
The lessons are very clear. We are in this country, we fix our country. We have to spur manufacturing. And it is very good. We cannot be depending on importing things from outsiders. We have to spur manufacturing in this country, industrialization. We have to cut the bureaucracy. We have to care more about the poor, not just about the rich. The rich are here with us. If you get corona, you die in Kenya. Nobody wants you in India. So you better fix the healthcare system as a leader to ensure we're here. And I've said thank you very much for the interview. Sorry we started late, but I've got another interview that is starting now also.
For making time.
Thank you. And when corona is over, please invite me. I'll come to your TV station.
Very modest about your friends, but when you go to the COG meetings, please wanongoneze, waambie all Kenyans need is service delivery.
Sawa, nitawaambia. Thank you and God bless you.
God bless you too. That's where we leave our conversation. After the break, my mic goes off and your voice comes on Social Watch.